Women are more likely than men to visit a doctor, about 30% more often. They're also much better at keeping up with regular checkups and preventive care, doing this twice as well as men. Meanwhile, men tend to skip checkups, delay getting medical help, and ignore symptoms. In this video, let's find out the common signs of a serious health problem that no one should ignore. The first sign is dizziness. Dizziness makes you feel like you're about to faint, unsteady on your feet, or everything around you spinning. It happens when your brain doesn't get enough blood flow, which can occur suddenly if your blood pressure drops, or if you're not drinking enough water. Dizziness is often linked to common issues like the flu, allergies, or low blood sugar, but it can also be a sign of more serious problems like heart disease, stroke, or shock. Shortness of breath is another sign that you must visit a doctor right away. Having trouble breathing during routine activities should be taken seriously. Even if the symptoms are mild, they can be important. For instance, getting out of breath after a short walk might be a sign of coronary artery disease, which occurs when an artery that delivers blood to the heart is blocked either partially or entirely. Another telltale sign of a health problem is excessive thirst. Drinking enough water is important, but always feeling thirsty might be a sign of a health issue. It could be a symptom of diabetes, where high blood sugar makes you thirsty as your body tries to get rid of the extra glucose. Regular blood tests can help check your glucose levels and watch for diabetes, especially if it runs in your family. Constantly feeling thirsty can also indicate internal bleeding, infection, or organ problems. The fourth sign is bloody or dark stool. Bowel movement colors can change naturally due to what you eat or the medications you take, but it's important to notice if your stool turns pale, black, or bloody. These changes can point to serious health problems. Black stools might indicate bleeding in the upper part of your digestive system, while bloody or dark red stools can mean there's bleeding in the lower part. Regular occurrences could be signs of issues like hemorrhoids or ulcers. If you see unusual color changes in your stool, reach out to your doctor promptly. Feeling tired after a rough night or physical activity is normal, but it's a warning sign to see a doctor if you're tired all the time for a long period. Persistent fatigue could be a symptom of various serious conditions, such as certain cancers, infections, kidney or liver issues, diabetes, or heart problems. Sleep disorders, thyroid problems, anemia, and psychological conditions like depression can also cause ongoing fatigue. The next sign is excessive snoring. If you or your partner are frequently awakened by snoring during the night, it might indicate obstructive sleep apnea syndrome. This condition involves repeated pauses in breathing while asleep, which can lead to daytime fatigue and a higher risk of health problems such as high blood pressure, irregular heartbeat, heart attack, and stroke. It's important to consult a healthcare professional if you suspect sleep apnea, as they can recommend tests and treatments to help manage the condition and improve sleep quality. While most coughs go away within a week, a persistent cough could indicate a more serious health issue. It might be caused by chronic infections like bronchitis or by common conditions such as asthma, acid reflux, or sinusitis. Certain medications like ACE inhibitors used for high blood pressure can also lead to coughing as a side effect. If you have a cough that lasts more than 3 to 4 weeks, it's important to see a doctor. Even if you smoke, don't hesitate to seek medical attention, because a smoker's cough could be a sign of COPD, a serious lung disease that worsens without treatment. Other serious causes of persistent coughing include lung cancer, a blood clot in the lung, or heart problems. Early diagnosis and treatment can significantly improve outcomes. The next sign is occasional heartburn. Although occasional heartburn isn't usually a big worry, if someone has it at least twice a week, it could be a sign of gastroesophageal reflux disease or GERD. GERD can lead to inflammation, bleeding, and ulcers in the esophagus, and may raise the risk of developing cancer or precancerous conditions. If you have frequent heartburn, seeing a doctor for proper diagnosis and treatment is wise. The ninth sign is vision problems. As people get older, their eyesight can decline. Regular eye exams are crucial to detect potential issues that might not be obvious otherwise. Symptoms like blind spots, blurry vision, tunnel vision, or seeing halos around lights could indicate serious eye conditions. Checking eye pressure can help diagnose glaucoma, along with other diseases such as cataracts, diabetic retinopathy, and macular degeneration. Vision issues can also sometimes be linked to stroke or the development of a brain tumor. Regular checkups with an eye specialist are essential for maintaining eye health and catching problems early. The next sign that you should never ignore is swollen joints. If your joints feel stiff or swollen, it could mean there's a health issue. This can happen in your hands, feet, or knees. It might be early signs of common arthritis, but it could also point to more serious problems. These include autoimmune arthritis, hormonal imbalances, immune system issues, poor nutrition, or insufficient activity. If joint stiffness or swelling lasts for a while, see a doctor to find out what's going on and how to treat it. If you notice a new freckle or mole with an unusual shape, or if an existing mole changes size or color or starts bleeding, you should see your doctor. These could be signs of skin cancer. Men who spend much time outdoors without sunscreen are at higher risk. Skin cancer can develop anywhere on your body, including areas not exposed to the sun, though it most commonly appears on sun-exposed areas like the face, neck, hands, and arms. It's essential to check your skin regularly for any changes and to use sunscreen with a high SPF to protect your skin. Wearing protective clothing and avoiding the sun during peak hours can also reduce your risk. Some types of skin cancer can be severe, but if caught early, they are often treatable and curable. Regular skin exams by a dermatologist can help with early detection. Frequent urination is another sign that you must see a doctor immediately. One common cause is diabetes, where the kidneys work harder to remove excess sugar from the blood, leading to increased urination. Prostate issues, such as an enlarged prostate or prostate infection, can also cause frequent urination. Symptoms of prostate problems include weak urine flow, pelvic pain, and blood in the urine or semen. An enlarged prostate is common in older men, but should not be ignored, as its symptoms can mimic more serious conditions like prostate cancer. Frequent urination can also be caused by urinary tract infections, which are more common in women, but can affect men as well. Symptoms of UTIs include a burning sensation during urination, cloudy urine, and pelvic pain. Occasional constipation is common, especially as people age. However, chronic constipation can cause discomfort, hemorrhoids, and other health issues. It may also suggest an underlying problem that disrupts regular bowel movements. This can include physical obstructions like tumors, twists in the intestines, or conditions that affect how the colon moves. If you experience chronic constipation, it's important to see a doctor for early diagnosis. This can lead to effective treatment and management of underlying conditions, improving overall health and comfort. Regular exercise, a diet high in fiber, and staying hydrated can also help prevent constipation. The last sign of a health problem that no one should ignore is erectile dysfunction. Erectile dysfunction is a common condition that can be challenging to discuss, but it often indicates underlying health issues. It is frequently linked to problems with blood flow, which can affect not only your ability to achieve an erection, but also your heart and brain health. Research suggests that experiencing it could potentially predict a heart attack or stroke within the next decade, especially if you smoke or have a family history of heart disease. Seeking medical advice for it is crucial because it can help identify and manage conditions like high blood pressure, diabetes, or cholesterol problems that may contribute to erectile dysfunction and pose risks to your overall health. If you have been dealing with any of these signs for a long time now, it's highly advisable to see a doctor immediately. What do you think are the other signs that you should never ignore? Feel free to share your thoughts. If you like this video, don't forget to subscribe to the channel and tap the notification button to stay updated on the latest.